Hello, my name is Dr. Fana-Souchet. I'm the medical director of AMA Medical Group. And one of the questions that I get when my patients come in is, Dr. Fana, do I have diabetes? Do I have prediabetes? What's the story with that? And one of the things that I tell them is that is why it's so important that you come to your doctor once a year so we can screen you for diabetes depending on your group age and whether or not you have other risk factor like obesity. One of the most common symptoms is that people get very tired, they get thirsty, some of them towards the end, and we don't see that as much now because we're screening aggressively for diabetes, but it's that weight loss, and part of it is because these people get dehydrated from the amount of sugar in the bloodstream that is floating around but they're not able to absorb. By a simple blood test we can check whether or not you have diabetes. There's few different ones, but there's other risk factor as well that we take into consideration. But measurement alone in two different occasions is the diagnosis. I want to talk a little bit about the prediabetes because these are the patients that are walking around and don't know that they have diabetes. Perhaps because when they do a routine test, their sugar levels in the mornings are normal. The problem is that those patients will develop, 100% of them will develop diabetes. If you have prediabetes, you have the same risk factor of a diabetic patient of developing the same complications, such as stroke, heart attack, problem with your nerves, problem with your kidneys and your vision. Again, like in everything, diet and exercise is very important. It's important to not stop eating sugar, but eat the right sugars, like the whole grains and the fruit and the vegetables. Your heart rate needs to be at about a certain level to improve your heart and for cardiac prevention and to decrease your cholesterol and so on and so forth. Again, the prediabetes is something that a lot of the patients come with that and they're not aware that that increases the risk of cardiovascular disease, so it's important that we can detect early so we can treat them and we can potentially reverse their disease progression.